Hi, my name is Faojia Sultana. I'm a second year DPhil with the Health Systems Collaborative Research Group. The working title for my research is Assessing the Climate Risk, Vulnerabilities, and Policies Associated with the Impact of Global Warming on the Secondary and Below Level Hospitals of Bangladesh. My supervisors are Professor Sastia Molineux and Dr. Jake McKnight. A bit of context to my research, starting with the term global warming, which basically means an increase in the atmospheric temperature of the Earth. Global warming is a subset of the broader term climate change, which means a long-term shift in the weather pattern and temperature of the planet. Both global warming and climate change have been associated with various climate-sensitive diseases and health outcomes such as malaria, dengue, etc. Basically, an increase in the global temperature leads to various extreme weather events like flooding, storm, drought, heat waves, which in turn increases the prevalence of this kind of climate-sensitive diseases. However, global warming does not only impact human health, but also affects the hospitals and healthcare facilities negatively, which are situated in this affected regions. Basically the rising temperature and the associated weather events like flooding or extreme heat causes infrastructure damage, energy system impacts, supply chain interruptions of this hospital, resulting in a kind of a negative work environment for the healthcare workers who are working there, not to mention the physical and mental health impact that they suffer by staying there and in that region. So all this impacts on the hospitals basically results in suspended operation and interrupted patient care in these areas, which is difficult for the local communities who rely heavily on these hospitals for their healthcare. And that is why I'm trying to understand to what extent the hospitals and the healthcare facilities in these areas are being affected by global warming, especially in a country like Bangladesh, which is known to be highly vulnerable to various climate change hazards. The research questions I'm asking are, what are the key physical, operational, and workforce risks and vulnerabilities of the hospital resulting from global warming? And what are the current priorities of the health industry of Bangladesh in terms of dealing with this impact? In order to unpack this research questions, what I intend to do is a scoping review and a policy review during the first stages of my research, which I'm already doing. And I want to complement the findings from the first stage with the second stage, which is fieldwork, which encompasses interviewing the policymakers and key stakeholders associated with this issue, as well as case studies of the hospitals involving interviewing the healthcare workers, as well as doing vulnerability assessments of the hospitals and health facilities. I hope with this data that we find during these first two stages, I want to classify the climate risks suffered by these hospitals in these areas and find out what solutions can be provided to manage the risks in each categories. Thank you very much.